If you've been following me for the last few years on the opioid plague, you would know that Appalachia was one of those exceptionally hard hit places. So bad that we were hearing all kinds of news coming out, and it was Appalachia was one of those places where they had to get refrigerated trucks because they were running out of space at the morgue. And I know many of you remember that. Well, whenever you have drug addiction, you will also have disease. It just goes hand in hand. So now we have a hepatitis C problem that's rising across Appalachia. So it seems like as soon as you get out of the woods in one area, then there's another area that people are falling in. And with needle sharing and people transmitting all kinds of HIV, because HIV is another problem in Appalachia through sex. This is now rolling into something entirely different now, along with drug addiction. So, like others throughout Appalachia, Addie believes that harm reduction, helping people add the adverse effects of certain behaviors like drug use, is key to slowing the spread of hepatitis C and other infectious disease epidemics that are a byproduct of the nation's opioid plague. 27 years ago, the New York Times published an ominous headline: Hepatitis C may be hidden epidemic, study shows. In that 1992 article, Dr. Leonard B. Seif said, "We are seeing the tip of the iceberg. Today, the iceberg is squarely in view. Hepatitis C transmission has skyrocketed across Appalachia, and the public health community is scrambling for solutions. The U.S. Center for Disease Control and Prevention now considers Hep C an epidemic and estimates that there are 2.4 million Americans living with the disease. As a comparison, that more than double 1.1 million Americans living with HIV. Yeah, HIV is another one. In fact, there were a couple of years ago, there were many articles coming out about the HIV that was cropping up in those same areas where drug addiction to opioids was going strong. In central Appalachia, the number of young people diagnosed with hepatitis C quadrupled between 2006 and 2012. Today, Hep C kills more Americans than all other infectious diseases combined. Wow. It's that widespread. People can live years before knowing they have Hep C or show symptoms. This is why it's called a silent killer. It can lead to cirrhosis, liver cancer, and even death before it's detected. Moreover, with the rise of the opioid plague, injection drug use has become the leading cause of transmission. And due to stigma associated with drug use, access to care and treatment is a significant barrier for far too many. Mm-mm-mm. There are many reasons why people use drugs, regardless why they deserve unfettered access to treatment and care, just like anyone else. Our policies and healthcare practices should reflect the inarguable truth. Harm reduction is built on the principle that we should respect the dignity and rights of people who use drugs and do what is needed to eliminate stigma and discrimination. Really? They sure didn't feel that way during the crack epidemic. During the crack epidemic, if you had an addiction, you were a criminal and you went to jail. Okay, now they're trying to use this soft, gentle approach for opioids for very obvious reasons. It's also vital to preventing the spread of infectious diseases like Hep C. Examples of harm reduction include test strips to check whether drugs include fentanyl, counseling, overdose prevention, education, and providing access to clean syringes and naloxone, a medication used to revive people overdosing on opioids. Equally important programs provide flu shots and hepatitis A vaccinations and connect people to treatment and housing, as well as provide vital support and other life saving information. Health practitioners, we know these programs work, provide clean syringes, was highly effective during the height of the HIV/AIDS crisis. A study in the 1990s of one of America's first syringe services program where drug users dispose the used syringes and obtain sterile ones found that people who inject drugs did not participate in the exchange were 7 times more likely to contract hepatitis C. Yeah, but when they dispose of those needles, they were all over playgrounds and in areas that kids played in. I even saw that when I went over to Kensington, over in Pennsylvania. That area, they have a horrible drug problem. A lot of heroin and opioids running rampant there. I stepped out of my car and looked straight down on the ground, and there were hypodermic needles everywhere. Everywhere. Okay. So, you might have come up with the solution, but it's really bad for areas where people are living around these drug addicts. So, you got to constantly get those hypodermic needles up. Despite this data, harm reduction has not been welcomed by everyone. Some people simply can't believe that anyone would advocate for giving syringes to people who use drugs, even though evidence show that if clean syringes aren't available, people will just find their way to used ones instead. In fact, lead organizations including Medical Association, the United Nations, and the World Health Organization have all voiced support for harm reduction principles that have saved countless lives. Now, ladies and gentlemen, in Philadelphia, they also came up with the safe injection sites where people can bring their illegal drugs and do it in front of a medical professional. And just in case they overdose, somebody will have some Narcan and bring them back. It's just amazing with all the stuff they have now. But one thing that is shining through, they can't do anything to stop the drug addiction, ladies and gentlemen. If this thing was not still going strong, you would not be looking at a rise in hepatitis C. Plain and simple. But y'all, please tell me what you think of this story that came out on Newsweek. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.